Hey, good afternoon, everybody. Can you guys hear me?
Yes.
Perfect. So, Dr. Ogechika Alozie, I'm the Chief Medical Officer at Del Sol Medical Center. We're part of the Las Palmas Del. Oh, hello, Jon Law. We're part
Hey,
of the Las
Dylan.
Palmas Del Sol Healthcare Network. I am originally from Nigeria, grew up in Minnesota, did my MPH residency in infectious disease fellowship in the Twin Cities before moving to El Paso in 2010. First 9+ years, I worked at Texas Tech, started an HIV clinic, became their chief health informatics officer, did a bunch of stuff, met John, and now I'm over at Del Sol. And so that's it.
All right. And so, Jon Law, I see that you're also on. So, yes, if you just, same thing, want to introduce yourself a little bit, who it is you work for, what it is that you do, that kind of thing.
Sure. So I'm the Chief Strategy Officer at University Medical Center. Um, in the strategy role, I'm sort of figuring out what's the future of the hospital and what are we going to do differently? What service lines are we going to bring on? How are we going to grow? I've been in El Paso for over 20 years, grew up in Phoenix. My family's from Southern Arizona, Nogales. And I spent probably about 15 years at the Paso Norte Health Foundation, left there in 2014. And good friends here with Dr. Alozie. Hope I get to take a couple jabs at him before we're done, just for giggles, and look forward to meeting you all.
Okay, great. Estela, are you there? Can you hear us? No? Okay, all right. Well, we'll circle back to her afterwards. So I think obviously the biggest question right now is if you guys can just talk a little bit about how your organization has been impacted by COVID. Obviously, you guys are right at the front lines of it.
You want to go first, John?
Sure, happy to. COVID's probably affected us in several ways. One of them is obviously we have patients that all have the same disease that have been infected, and that's a different patient population. And so what does that mean? It means particularly our nursing and our physician staffs in certain units are wearing more protective equipment than they would have before this. It also means we have certain parts of the hospital that are sort of designated as places where you're exposed to COVID because you have patients with COVID-19. I think one of the questions, and we can talk about this more, is, are there enough beds? Is there enough capacity? At this point, we've been able to manage our capacity, and I can talk about that in more detail. I think it certainly puts stress on the providers, the nursing staff, and the physician team, and Dr. Alozie can address that better than I can. The last element of it, though, that's a piece of this is that there's a financial impact, and particularly back in, I guess it was March and April, the governor opted to not allow us to have any elective surgeries. And at that point, we had plenty of capacity. And so there was about 6-7 weeks when we couldn't do surgeries and other types of procedures. And we felt we could handle them. And so there was a lot of lost revenue. I would say we probably lost, I don't know, easily $10 million in revenue during that time period, if not more. So there's a real financial impact to how this plays out.
Yeah, I agree with everything John said. I think that if I think from a healthcare organizational standpoint, walking into it, if we had to do it all over again, I think that our biggest sort of organizational misstep was shutting down some of our surgeries, like John mentioned, but also shutting down some of our planning. And not that it went away, but we slowed it down. There was this impression, unfortunately, that this was going to go away because the peak started to come down in New York. And there was a host of people that said that was not going to happen. But so responding to that, I think, is the biggest thing. I'm pretty sure in John's organization, mine, and the local tenant hospitals, T-HOP, we've done a relatively good job at managing our PPE. And again, the beds aren't necessarily the issue. You can get beds. We can create beds. We can rig a bed. We can figure out how to plug things into sockets that don't exist. The good thing about construction is that drywall and you can lay lines. The problem is human beings, right? So it's the human capital or the human supply chain that's short. None of us, if we would push comes to shove, really has enough of our own nurses, between nurses that have decided they no longer want to work at this point in time because they don't need to, nurses that may have become infected and are out until they're uninfective, they can't transmit infection. I think that's really where the concerns come. And so we're thankfully not where Houston is or San Antonio. I hope we never get there truly, but it's one of the things that we think about every day, probably 3 times a day in our operations meetings. We're thinking about how to manage that.
I think also, in addition to what Dr. Alozie said, so both of us have been involved in the surge planning for the city. So, we're thinking about and we're working with each other, and that includes Hospitals of Providence, to figure out, okay, how many beds does El Paso need? How many do we have? Are we short staff? We've even had conversations, okay, if, UMC short some nurses, can we pick some up from another hospital or vice versa? Those conversations are going on all the time. And, Dr. Alozie and I have known each other for, probably about 10 years now. And our CEOs all know each other. And a lot of us, because of the kind of community El Paso is, we sort of grew up professionally together in different situations. So it's perhaps not as competitive or as fractured as you might see in other environments. We definitely compete, but it's sort of a friendly competition.
Yeah, I agree. I agree. So knowing some colleagues, like John said, that are in other markets, it's a lot more cutthroat. It's a lot more difficult to engage on a collaborative level. John can call me, David Shimp can call Nico can call Jacob Centron, et cetera, and they can all call Mayor Margot, right? Or I just blocked on the rest of our executive leadership. But yeah, they can all call each other and have conversations about what they feel or give their input on what's important for the community.
I'm on mute. Either generally or during COVID, what have you guys found to be unique about serving the El Paso population? I find El Paso, I am not from El Paso, I find it to be one of the more unique cities in America, not health necessarily, but just kind of culturally, where it's located, all that. But I'm curious if that comes up in the health field at all.
John's been here longer, but in the 10 years I've been here, I think, like you said, it's a unique culture, unique geographic location. From a COVID standpoint, I think our geographic isolation and the fact that you can't get here from Europe by a direct flight is what probably helped us. It gave us time in that kind of spread of the viral dynamic standpoint. I think that I've enjoyed being a physician in this community. From a cultural standpoint, the families and patients are always much more appreciative than I ever got in the Twin Cities or when I did locum on the East Coast. They actually are grateful. And so that always feels good. It fills your emotional or your heart bucket. One of the things that we all know from the healthcare standpoint is that we have a healthcare shortage. Or if you look at doctors per population, we're probably one of the 2 or 3 lowest in the state. And so that causes an issue. For my colleagues, it doesn't cause an issue because from a physician standpoint, the reality is this: if you come to this town newly, within 90 days, you'll have a full panel, right? And you'll have way more patients than you can ever possibly take care of. However, from a patient standpoint, this is wearing my other hat as I sort of talk about digital health and technology and ways that you can create and enhance access across the board. It's frustrating being a patient because if you try to get into the average physician in El Paso, it's at least a 6-week wait. And some doctors it's 3 to 6 months just to get a first visit. So I think those are sort of the pros and cons, right? You're emotionally and from a physician standpoint, financially, it's great, but there are shortages, and this is where we start to see some of those shortages, at least for us, on the nursing side and some of the physician side as well.
Yeah, I would say, well, first of all, you're going to have a long wait if you try to go to Del Sol, like he was saying. If you come to UMC, we don't have that problem, but no, in all seriousness, I agree with what Dr. Alozie said. I think the other piece is that it's just a more personal community. And, I'm not a provider, I'm an administrator, but I'm in the hospital every day. And, I'm in the elevator with people I know. that I knew outside of the hospital. So there's people in the hospital that are relatives of friends or friends themselves. And I think that's probably a little different than other communities where it's personal. And I guess I should say too, you know, we have friends and connections that could be in Dr. Alozie's hospital or hospitals of Providence, and our peers, we call them and say, hey, we got somebody in there that's close to us, take a look after them, and they will. And that's just the personal nature of El Paso. It's really, you know, it's a pleasant place to work for those reasons.
Great, thank you. It's always nice to hear about why El Paso is good, of course, for all of us being here in El Paso. Oh, hello?
This is Estela Reyes. I hope you can hear me.
We're having a bad feedback. Are you able to mute your other source of audio? Oh.
Okay, Nora, can you hear me? Okay, Nora, can you hear me? Nora, can you hear me? Nora, can you hear me? We're trying to solve the feedback problem.
Hello?
All right, Nora, can you hear me now?
Yes, we are good to go. All right, so we'll just take a step back for a minute. Estela Reyes is joining us. She is the Media and Relations and Public Information Officer for Centro de Salud Familiar de la Fe. So kind of a different side of healthcare providers. Estela, if you just want to briefly introduce yourself and what your organization does.
Well, good afternoon, everyone. I hope you can hear me. I can finally hear you well. Hope everyone is well. Abrazos to everyone. Dr. Alozie, haven't seen or spoken to you. Jon Law, it's great to see you all. And it's good to be a part of this. Apologies for the technical difficulties. But I'm glad we are touching on this subject with the class of Leadership El Paso. Normally, I know we don't touch on subjects quite this heavy, but it's important that we do because we're talking about people's lives, their well-being. And here at La Fe, we are on the front lines of this situation with our patients who are registered with us. We're not doing testing for the general public, only for our patients here in our community, but what we're seeing is devastating. You know, the issues that have always affected our community, poverty, lack of access to physicians, lack of resources. This situation with COVID has just pushed everything to the front edge. And it's been very difficult. You know, what Dr. Alozie and you know, Dr. Law were talking about earlier, you know, we're seeing it on a daily basis here, and our community is in dire need. Our staff is in dire need. Our providers are in dire need. And so we are hoping that our community's leadership will do what it can to bring us the supplies that we need, the PPE, of course, but also help our staff, you know, be able to do their jobs and do it well.
All right, thank you. Well, I was wondering if, I know some of you have kind of touched on this before, but what you feel like your strengths have been as organizations going through COVID-19, where you guys think you've really stepped up. Whoever wants to start.
I'm sorry, is that question for me first, or?
For all three of you, if you want to weigh in first, go for it.
Okay, no, sure. You know, in this situation, our strength as an organization has always been our cultural understanding of our people's needs. And right now, there is so much fear and misinformation, and there's so much tremendous need for a sensitivity to our community's cultural needs in a situation like this. We have a lot of folks that hear 20 different things when it comes to how, when, and where they can and can't go in public, how, when, and where to wear a mask. The most basic of tools that we have right now as community members to protect ourselves and those around us. Very few people are spreading the information that you need to wear that mask completely over your mouth and your nose. And we're seeing a lot of folks in the community. I think any of us, if we were to head into Albertsons or any store, we would see folks walking around with the mask just below the nose. And when you tell people, you know, you explain, no, señora, the mask needs to cover everything, your mouth, your nose, they're surprised because that's not a message that they're getting. And I think we as providers, as educators, as people at the front lines of this situation, we need to help educate our community on that.
Thank you. Dr. Alozie or Mr. Law?
You know, I'm just really proud our organization, I think, has adapted to a lot of changes. You know, you just operationally really have to change a lot of different things from a hospital standpoint when you have the risk of infection. And so there's just a number of operational changes that have been made relatively quickly. We've increased our telemedicine capacity, which is one of the things that I think is really valuable during this particular pandemic. So people can access care remotely and minimize the risk of exposure. Those are the two things that really jump out at me of things I think we've done well. The other thing, and I alluded to it before, but we've expanded our capacity. So we've modified the hospital in different ways. So we have more beds. We've found ways to utilize our staff differently so we can get better coverage for more people. And so those are things that I think we've done pretty well. And, you know, I mean, certainly I agree with Estela. You know, this is a very human, difficult, you know, scary thing. And I think it's particularly scary when people get infected. They just don't know how they're going to be impacted, regardless of how old they are or whether they have pre-existing conditions. And I think there is a lot of legitimate fear. Having said that, I think we've done a pretty good job as a hospital to provide the best care we can. The other thing that we've seen that has impressed me, and I'm not a clinician, but the clinical community and this goes for all the hospitals. For example, when you look at something like remdesivir, which you've probably all heard about, they were using it clinically one way when it came out, and now they're starting to use it differently. So within about a few weeks, the medical community realized that if you use that drug earlier in the treatment process, the outcomes would be better than if you used it kind of at the most dire moments. And so to see that kind of learning and growth across the medical community, I think is impressive in a pretty short amount of time. So there's been a lot of communication amongst our physicians, and I'm happy they've done that.
Yeah, I would say the same thing. It's been kind of amazing, actually, when you think about across all the hospitals, right? Doctors talking to each other and just being focused on the patient care and trying to make sure that the patients are getting the best care. So I think the other thing that Jon talked about was, as an infectious disease guy, it was always funny to me when people would say, well, I can't wash my hands and it's really onerous and, you know, I just got to go from patient to patient. And now I see the same people washing their hands 20 times per floor and per unit just to go from one section to another. And you realize that fear is a really interesting motivator. So yeah, human nature, I guess.
All right, thank you. So the other question I wanted to ask is, I know that obviously right now we're still kind of seeing like rising cases, rising hospitalizations, but are you guys taking any steps now to try and kind of anticipate the future waves or even like a future crisis of this scale? Are you kind of learning and trying to put in place things that would serve you later?
Yeah, I'll go first. I think that the short answer is yes. That one thing that this has forced us to sort of realize again is that public health is important. Now, obviously, none of us controls individually public health funding, but I think working together and aligning where we have a better sense, and we've hopefully conveyed to some of our elected leadership that public health is important. But the only other thing I'll call out is I have become a non-fan of the wave connotation or the surge. It's not your fault. It's everywhere on the press, right? But I really think of this more like a fire. We had a fire. We didn't put it out. It was smoldering, and now it's hit the rest of the forest, right? So we have a huge forest fire burning. We're going to have to figure out how to contain it over time and not let it break out of those limits again. And so that will force us, sort of whether we like it to or not, both locally, statewide, and nationally, to really sort of refocusing on public health again.
Mr. Law or Estela, do you want to weigh in just about any kind of changes that your organization is making moving forward from this to kind of anticipate these kinds of crises, or even to just anticipate the continued fallout of COVID?
Yes, thanks, Laura. One of the things that we are working on is messaging through public service announcements. We're in the production stages of those through our, we have a few communication efforts that we're putting out into our immediate area here in Segundo Barrio and in South El Paso, mostly Spanish language targeted, to let folks know some of the basics. You always need to go back to the basics and let folks know how to wear the mask. Always wear the mask. Wash your hands, like Dr. Alozie said. Pay attention to those things. Talk to your kids. Make sure that they're not out there hanging out with their little friends and thinking that they're immortal, that they're untouchable in this. Children are susceptible. We know that. We know that our elderly, especially so. We are really pushing the message hard to our clients and to our staff as well. I guess all I can share with you, on the personal side, like many of you, I have an elderly parent at home. I've got an 83-year-old mother that I have not been able to hug and touch the way is natural to our community for many, many months now, and it has been incredibly trying. And to make matters even more challenging, I've also got a younger sister at home who is fighting her way through stage 3B cancer. So if anybody has to really watch it with who I let myself get exposed to, it's me and my family right now. But unfortunately, everywhere I go, and I'm sure all of you have seen it as well, I see people walking about amongst others, in restaurants and bars. I've seen people that I know and respect discourage others from wearing the mask. And that's a little scary. Unfortunately, a lot of this is about fear. But sometimes fear is a great motivator to remind you why you need to take care of yourself and others and why you need to spread that message. Stop what you're doing, think about what you're doing, put that mask back on, put it on correctly, wash your hands, watch how you physically interact with others, and do what you can to take care of yourself and you.
I would, the only thing I would add is that I think, I mentioned before telemedicine. I think that, so what's happened is that CMS, the federal agency that funds Medicare and Medicaid, has allowed us to use telemedicine more liberally than we could before the pandemic. And so it's kind of opened the door to a lot of use of telemedicine that we didn't do before. And I think that's a change that isn't gonna turn back the other way. I apologize, I got a dog that was like barking and so hear all the noise. I'm trying to comfort her. So the telemedicine is one piece. I think the other thing is that I know I'm spending some time thinking about how we build our facilities and how are they laid out, so you think about like clinic space, do we have space for people that maybe are there for a physical and they're not there because they're ill? And then a space for people that are maybe there because they might have the flu or something else. And can we lay out our clinics and our hospitals in different ways so we can kind of control any possible infection in the context of the treatment environment. And then the last thing I would say from a public health standpoint, I think our community needs to spend more time figuring out how we protect the population against any kind of transmission between animals and humans. And we don't really know the history of what happened to COVID-19 in China. And I mean, I don't know the facts, but I do know that we've seen a number of outbreaks that have been with the transmission from an animal to a human, and then it goes across the human population. And so I think that's something, as humans move into the environments where animals live, there's different risks, and it's possible that a future outbreak could similarly emerge.
Too proactive a muter. So that kind of segues into what I think maybe would be one of my last questions, since I know we're running up against the clock a little bit here. But kind of setting aside COVID, what do you think are kind of the other health challenges for the El Paso community? I mean, I know COVID kind of is absorbing all bandwidth, but just if we were looking a little bit further out, or is it just similar kinds of outbreaks that you're concerned for?
Well, one of the things that definitely concerns us here at La Fe, and it's always concerned us, we've been very vocal about this for many, many years, the incredible lack of providers in our area. And I'm sure, Jon and, Dr. Alozie can speak to this as well, but that's one of the major concerns in our community. You can provide everybody magically with medical insurance, but if you don't have access to a provider, as we say in our community, de nada sirve. We've got to make sure that when we talk about true community health care access, that we make sure that our people are able to reach the doctors they need, the nursing, providers that they need, the other medical professionals that they need, and have the access to the medical services, regardless of their income. I know there's been some comments in the past from elected officials saying that healthcare is not a right. I'm sorry, we call that out on the street as completely ridiculous. It is a basic human right. And anybody who doesn't believe that, I love them to trade places with somebody on the lower income level in our community and see what it's like to have children, to have elderly people, to have folks who have a true medical need. And this is coming from an organization. We primarily do frontline primary health care. We don't do specialized medication. So put yourselves, and when I ask this question, I ask it of every single one of you that I see on screen right now. Put yourselves in the place of a community member with children, with elderly, who is vulnerable economically, culturally, language-wise, other barriers. And then give yourself a major medical challenge and see how you are able to maneuver your way through that. See how you are able to protect your children and your family members and face the challenges of a major health crisis. That's not very simple to do.
I think from a disease standpoint, chronic disease is an incredible impact on our community. I mean, certainly diabetes. Honestly, the impact of diabetes is such that I don't even think we know what proportion of people have diabetes. And some of that speaks to what Estela was talking about. People maybe haven't gotten the care they need to even be diagnosed, or they maybe haven't had the opportunity to even understand the disease and how it affects them. So whether it's heart disease or other types of chronic disease, to me, that's something that is a chronic focus of our organization, is trying to figure out ways to get people care earlier in the disease process so their long-term quality of life can be better if they get the treatment earlier. And certainly access is a key thing. To kind of piggyback on what Estela was saying, I always think about access as three things. I think about it as, is it affordable, and is it available, and is it acceptable? So, the affordable is often insurance coverage in the US.
Yeah, so I have.
Yeah. The available piece is what Estela's talking about. If we don't have the providers, then they're not there. And then the acceptable comes down to culture and language and other things people need to be able to interact with their providers. So if you don't have the culturally relevant and linguistic skills you need out of your provider, if you miss any one of those, you don't have access. And so a lot of times the conversation is just about the affordability part. And I really agree with Estela that it's these other components that together, you have to have all of them to get access. But the chronic disease impact on our community is significant. And the one last point I'll make, and then I'll hand the baton off, is that our community is getting older. And when we look at the age shifts, the group that's growing the largest is 65 plus. And so a lot of the health issues, even Estela was talking about her family that was challenged, there's different healthcare needs for that population. And one of the things I've learned in the last year that was really kind of an eye-opener for me is, we think of people as from 65 up as like one whole group of people, and it's probably three different groups of people. And so you have a group that's maybe in their 60s that's still active in a lot of ways. Then you have folks in their 70s. They're still mobile, but maybe their mobility is going down. The type of illnesses they have starts to become more tied to cancer or chronic disease versus in their 60s, they may need knee replacements and things like that. And then you get to folks that are maybe 80 plus that really are, have really more inhibiting conditions. And they just need a different type of care. And so, and particularly in the context of COVID, that group is high risk. You know, just sharing family stories, my own grandmother turned 100 years old last weekend, and she has had a heart condition. And I was just talking to my mother about an hour ago, and my mom said, you know, if she had to go to the hospital, I don't know that I'd take her. And my mom's position is, at this point in life, I'd rather she be with family than get separated from me, because the hospital may not let a family member in to be with her. And so those are the kinds of things that I think we have to navigate in a pandemic, but also in an aging population. Dr. Alozie, close it out.
I'm not sure I can say it better than the two of you have already said it, right? You've identified all the key factors. And so I'm not going to belabor it. I think that challenges that we have upcoming are getting providers, whatever we want to define a provider as in our society, whether it's a physician, NP, or PA. I always say that healthcare is not a football game where the doctor is the quarterback. I think of it more as a soccer game where everybody has a role to play on the field, and you need all 11 teammates for you to actually get to the goal or defend the goal. And so I think that's going to be our biggest key. And I think, like Jon said earlier when he talked about telemedicine, I really do believe that because of sort of our geographic isolation and sometimes the difficulties we have with recruiting people, that technology may be what helps us hack that, right? Whether it's telemedicine or teleconsultations, but then comes the part about access, right? We're gonna have to ensure that we have broadband, right? And so those of you that work in organizations, either that are electrical or broadband or telecommunications, your organizations are going to have to work with city, county, and nonprofits to ensure that that access is there. We've seen that, especially with schools being shut down so early and the huge disparities of access to broadband and things. I mean, me and Jon live literally 2 blocks away from each other, but the huge disparities, even in my area, of people that I didn't realize didn't have internet, or they had other things, but not internet. And so
there's actually huge disparities from his block and my block. Mine kind of down the scale. I'm just saying.
Oh, I love you.
Well, and we have to remember as well, everyone, that when we talk about technology, technology is like education. It is sheer unadulterated power. And a vast majority of our community, particularly south of I-10, do not have access to internet in their homes. Maybe their access is on their cell phones, but the luxury, and I purposely use that phrase, the luxury that many of us have to be sitting in our homes right now with a computer in front of us and be able to have the world at our fingertips is something that most folks in this community don't have. And when we talk about, you know, how can we make telemedicine accessible? Well, that's unfortunately not always going to be possible for all of our folks, obviously. And we also have to remember that many of the people that we're talking about, when we talk about this community and its most vulnerable, we're talking about very poor people, we're talking about Hispanics, we're talking about African Americans, we're talking about people of color, many of whom in this community are, as Jon said, you know, older folks. Some of us aren't that far from that age range, so we have to think about that as well, right? You know, I see Jon nodding as well in acknowledgement. You know, I have to think about that too. We have to think about our parents, our older family members. We have to think about the folks who are part of our community, part of our lives here, but have no access whatsoever because of their political status in our community. You know, we can't pretend that they don't exist, because when we're talking about disease, and we are obviously talking about disease, we know that disease knows no boundaries. And we have to care and take care of them as well, regardless of whatever is being, you know, said out of Washington, with or without, you know, good intentions. You know, reality is reality, and it is unfair to compare what is happening here in El Paso to the rest of Texas. Sometimes you can't even compare us to other counties along, you know, at the other end of the U.S.-Mexico border, because we are part of a community that is very unique, very special to the U.S.-Mexico border part of our world. And what we are facing is unlike anything else going on in this country.
All right, well, thank you. I don't know if anybody from the class has any questions that they want to ask.
I actually have a question. Um, so given the location with El Paso being on the border, two countries who have completely mismanaged the crisis, and, you know, culturally how we are, like my mom still wants to hug everybody. What is it looking like for us, you know, long term? Like how much longer will this impact El Paso than the rest of the country? Or what does that projection look like for El Paso and the number of cases?
You want us to take an educated guess, Carrie?
I don't know. I know Kai was telling me that he actually does forecasting on cases, but I would love any insight, or if you guys have an educated guess.
No,
Well, I can only answer for myself personally. I think we're all going to have to really get used to hunkering down for a long time to come.
Yeah, I agree. I think we've got at best many months ahead of us. I think that's our best case scenario. I do think, you know, Dr. Alozie said earlier, we are a little isolated in some ways because, you know, our airport has not got people flying in from all over the world. And so while we are very symbiotic with Ciudad Juarez, and I do think that the extent to which we take preventive measures, that will make our outcomes better or worse based upon how we do as a community. And being isolated, it gives us a little more control if we do the preventive behaviors we need. When I think about a community, say like Atlanta or New York or Minneapolis, where you just have such much more greater migration than we have, I think they probably have less control than we do. Having said that, we have a lot of the limitations we've been discussing over the last 45 minutes or so, that, you know, the population has to understand how to use masks, how to wash hands, you know, and to the extent we accomplish that, I think we could, you know, we could be protected from some of the consequences.
Yeah, I think those are both fair points. This isn't a 2020 termination event. I mean, this is going into 2021. I think if we had been lucky and sort of contained spread in those 2 to 3 months that we hunkered down, those of us that have kids would have been a lot more comfortable going into the fall. Not to say that the kids may or may not go back, but I think we'd be a lot more comfortable going into the fall with cases at 50 or 100, not at 11,000 a day in Texas. And so, and then the other things about it, right, when you're talking about the supply chain around vaccine, the supply chain around some of the antibodies and therapeutics that are coming down the line, even the flu shot, which most people don't argue about, they just don't want to take, has about a 50 to 55% penetrance into the population that it's indicated for. So then we're going to have to fight against the anti-vax movement. We're going to have to worry in the South about the history of Tuskegee and people that are just going to say, I'll wait until John gets this vaccine, see how he does, and then you can come and give it to me and my cousins, right?
That's what he did last year.
Exactly. I waited, right? So the Law family got their shots, then I gave it to my kids. And so I think those are huge forces added to the politicization and the segmenting of this country at the moment that are going to make it difficult. If we continue at this rate, we'll probably hit 40 or 50% by December, January anyway, and maybe we won't need to give everybody a vaccine, right? But this is something that we're going to have to live with. It's not rational and it's actually not possible for us to hunker down for 6 months. That was never the plan, but to change the dynamics of this, people are going to have to modulate how they behave.
You know, just one other factor, I know we're winding up, is one of the things we have seen in the hospital is people are delaying care. So in April and May, we saw less heart attacks and strokes than we would normally see in April and May. And we're pretty convinced that people in El Paso didn't have fewer heart attacks and strokes. We think they just didn't come to the hospital because they were scared. I know at our children's hospital, there were several cases where we had children that had like a burst appendices because they didn't come to get the care they needed. So one of the messages, I mean, it's, you know, it's wash your hands, wear the mask, socially distance, do those things, but also don't delay care you need, because that'll only make it worse. And, you know, our job is to provide the care in a way that's safe for you and your families. But that's what we need the community to know is, you know, if you really need care, come get it. Don't let fear get the best of you in that way.
Thank you. Are there any other questions out there?
I have a question. So it sounds to me like this could very possibly be a cycle, because I think that what we've seen with COVID is there are a lot of underlying conditions that already existed that were really brought to light by this pandemic, all sorts of things, but especially health issues, things like diabetes and blood pressure issues and other things that exacerbate the disease in people, and especially older people. And so, you know, I think part of it, and you all were talking a little bit about needing to access care, but so when that's delayed, you know, and something like this comes along, that could cause issues. People will continue to maybe delay care moving forward. How do we handle that appropriately so that our community, you know, gets on track?
You know, I think public education is the best thing we can do. And, but some of it is stuff that's, you know, it's really going to be a challenge. And I think Estela, I'm sure she can speak to this, but if you think about it, you know, I'm very fortunate. I get to the dentist every 6 months. I had an appointment in April that was canceled and I haven't been able to go back. Now for me, probably not such a big deal, but there's probably folks that do have serious dental issues. They maybe haven't been in a couple years, and it's going to be very hard to see the dentist right now. And so I do think that's sort of what's underlying all of this is what are the consequences if people delay or care that they're not even intending to delay, they just can't get. Like, and dentists are an issue. You can't, it's not easy to get into a dentist right now. So I do think, I don't know that there's an easy answer, but certainly if people are having really acute issues, they need to get to the emergency department. And that would be my message that I hope you share with others. You know, it's a rare case. You know, my grandma's probably the exception. You know, I mean, my mom is really having conversations about end of life. So she's saying, you know, she's going to die one way or the other in the near future. But outside that scenario, if you need care, get the care. And please share that message with others.
Yeah, I agree 100% with Jon. So as I've done various sort of media things recently, it's not just the 3 W's that we've talked about, wash your hands, wear a mask, watch physical distance. I've added the other W of watch your symptoms, right? And if you feel sick, get to a hospital. I still truly believe that all of our hospitals, maybe mine more than Jon's, are the safest places that you can be in the city in terms of infection, because we're the one place that you can't walk in the door without wearing a mask. There are hand washing stations at every point in time, right? And so, yeah, that's the message that has to get out, whether the chamber's doing it, the UMC, our group, we're all putting it on various social media platforms. But I think that's really important for people to understand.
What you touched on earlier, Alejandra, you know, the diabetes and the blood pressure, those are our top 2 diagnoses here at La Fe, always have been. And I'm pretty sure they're the top 2 or very close to the top 2 at every other healthcare site in our community, including the hospitals of these 2 gentlemen that are with me speaking today. What COVID did, not just for El Paso, but I think around the world, it exposed all the vulnerabilities that have been there for far too long, unaddressed, underaddressed. We've known for decades how vulnerable our community is health-wise, economically, because of the impact of diabetes. I don't think there is a single person on this conversation whose family or lives has not been negatively impacted in some way by diabetes. I lost my father to it. I'm living it with it myself. I have friends, family, my husband you know, it's a part of our lives here in our community. And because of that and other reasons, I think we're all having to think twice about who we stand next to on the city bus at a park, because we remember how vulnerable we truly are and those around us truly are. And I think going forward from this point on, whether you're part of the Chamber of Commerce and you tend to focus on business, economy, and tourism, we're going to have to pay a lot more attention as an entity to healthcare and not just make it, you know, a side issue. It just got moved to the front of the table, big time. We are all going to have to make it top of mind in every discussion we have, whether or not it has anything to do with healthcare. I think from this point forward, everything is about healthcare. And I don't think that's going to change for more than a few months. I think this is going to be something that we're all going to be living with, struggling with, but learning to live with for years. Sorry, Carrie, I know that's not the answer you were hoping for.
Sorry, I'm muted once again. All right, well, thank you so much, all of you, for joining us again. I know Health Day, obviously, we're catching you guys in the middle of a very, very busy time, so we really appreciate you talking with us and answering our questions.